Hey YouTubers, welcome back to my channel. Please like and subscribe. And today's video is actually answering a question from a viewer named Jen. So Jen or Jennifer asked the question, so are there reversible conditions in dentistry? That is, are there diseases that are starting to progress, but you can stop them before they become something that then needs to be treated more aggressively? Like maybe stop filling before it needs to be done, or stop the decay process for a filling before it needs to be done. Or no, I can certainly tell you one right off the top of my head: gingivitis. So gingivitis, for example, is definitely reversible. So the irritation of the gums that happens with gingivitis is the first step of gum disease, but it's not an irreversible step. So gingivitis can be reversed if you're brushing, flossing, keeping things clean. So as long as we're using the water flosser, whatever you want to do to keep the things clean between the teeth. But yeah, so gingivitis is definitely reversible, Jen. So that is answer number one. Answer number two, I'll use an x-ray to show you, and hopefully it'll be visible, but there are cavities in between the teeth. Now, if the bacteria and acid attack has not penetrated the entire enamel layer, with good flossing, good brushing, fluoride and toothpaste, and good home care, and fluoride from our visits too, topical fluoride that we put in varnish. If we can keep that under control, what you will see is that the area of concern will either stay the same on an x-ray, it won't advance. It'll either stay the same, and it can actually reverse. So the tooth can at least partially, I'm not sure about entirely, but partially remineralize. And so, yeah, it can be reversible. So those are things that are reversible. And let me show you on an x-ray what I mean, at least by the cavity part. I can't show you gingivitis, but I can at least show you what we call an incipient. That is, it's in the enamel and it's just starting, but it hasn't gone through the enamel layer yet, at least not on the view or the angle that we've taken the cavity checking x-rays with. And so that is technically something that is reversible. So let me show you. Okay, YouTubers, so this is what I mean by an area in between the teeth that may have something going on, which actually it is. Right here, there's a little tiny triangle on this x-ray right here. It's a little dark triangle, okay? And that is what our fancy term is incipient. That is, it is a tiny area of weakness in the enamel that is caused by bacteria that cause cavities, okay? So the bacteria are there, they're eating away into the enamel, but they're not through that layer yet. So what's critical in this case is if this person starts to floss and keep that clean really well and is brushing really, really well, then this can reverse. So Jennifer, this is an area that can reverse with good flossing, number one, brushing, with fluoride toothpaste to put fluoride into that system and reinforce the tooth, and with regular cleaning visits with topical fluoride application, usually using varnish. That's what a lot of offices are now using. They used to use trays when I was growing up filled with this goop, which was unfortunately pretty disgusting. So that is an area that is reversible. So Jennifer, that is an area that's reversible, to answer your question, and can be reversed. And we always hope that it is reversed, because really the less we do, the better it is. So Jennifer, thank you very much for asking that question. And hopefully my explanation was clear for you and the viewers. That way you understand that there are a couple things that are reversible. So like I said, gingivitis is reversible, and cavities, as long as they're not quite through the enamel, are also reversible. But it takes good home care to keep them that way and to keep them from getting into that next layer of tooth, the dentin, and to the point where we have to then intervene by doing fillings. So thanks again for joining me on this video, and hope you're all staying well and healthy.